start, we're learning that probably right before spring break, when I discovered this morning, when half my class was not in attendance, probably not the best time to schedule a talk like this, but we'll make up in quality what we lack in quantity. And I'm really happy to have Michael Shepard here with us from the University of Michigan. When people ask me, as they have, like, what's going to happen to red state voters when the Republican Congress cuts $800 billion out of Medicaid? And I say, well, you should read Michael's work, which I think, so the dissertation that this book project is based on won the Best Dissertation Award from the American Political Science Association's Class and Inequality section. I read the dissertation. It deserved that award. It's really extremely interesting and pertinent work. There's a bunch of other published work that you can find on Michael's website. His work's been published in Political Behavior, forthcoming in the APSR, I think forthcoming or maybe out already in the APSR, a bunch of other really excellent publications. And today he's going to talk to us about this book project on healthy democracy. Michael, we're really happy to have you with us, and the floor is yours. I'm supposed to turn this off if I can figure out where.
You all for having me. It's a privilege to be here and share this space with you. So this is my book project, hopefully able to be published in the future at some point. It's currently under review, so look forward to that hitting bookshelves in 2 to 3 years. Timely, quick publication process for academia here. So I just wanted to start with a plot from the book, which is presenting what I think is a puzzling reality, which is the relationship between the percentage of individuals who are uninsured in a county, and we could look at a variety of other different health metrics here, and their voting behavior. So overall, in the literature, there's a pretty robust and strong relationship between people having worse health experiences, having worse health outcomes, being uninsured, and their support for the Democratic Party. This has been documented in quite a few different ways. But it turns out that that finding is mostly either no longer the case overall or isolated in more urban-leaning communities. When we look at rural areas, the more folks in a community that are uninsured, the less likely they are to support the Democratic Party. And this, along with a few other sort of puzzling features of American health politics, got me thinking about what's going on here, why is this happening? Research questions for the broad book project are, how do partisan differences in health policies at the state and federal level shape the health disparities themselves? Like, what role do we have for politics and policy here? But also, why does it seem like individuals who are less healthy themselves or are more vulnerable in their health care in rural communities reject government assistance and increasingly support the Republican Party? For most of this, I'm going to focus on rural white voters in particular. That's where we have the most pronounced findings. There is some work that suggests that what's happening with rural whites are happening with other groups of rural voters, although perhaps less so. And I'm happy to take some more questions on that later. So the main findings of the book are that Democratic control of government at the state level is associated with about a 1 to 5 month life expectancy gain and better overall health outcomes for rural communities. So if we compare across states, Democratic governments are producing better health for their constituents and perhaps especially in rural areas. But despite this, we have what I call the rural health spiral going on in the red states, which is that the worse things get, the more resentful rural voters feel towards the government, towards the Democratic Party, and towards social groups that they associate with the Democratic Party, which leads to reduced support for government, reduced support for healthcare policies that might alleviate their struggles, and heightened Republican identification, even and perhaps especially in the states for which Republicans are in charge. Republican elite appeals to the shared racial and place-based resentments of rural Americans, what I call the politics of place and prejudice, allows Republicans to garner support despite and perhaps because of the effects of their policies on rural voters. even from the sickest and most vulnerable poor rural whites. This wasn't always the case, and in fact, there used to not be particularly large urban-rural differences in healthcare just a few decades ago. So as of 1980, rural and urban Americans lived similarly long lives, but over the last 40 years or so, there's been a real growing divergence here. The gap started to grow in the 80s, but really took off after the 2000s. And what we can see is at this point, there is about a 3.5-year life expectancy difference between rural areas and less rural areas. And what I'm trying to do in this project is situate what role partisan policymaking at elite levels, but also voter behavior itself, contributes to these diverging patterns. Depending on your measure of rural here, what you can see is some estimates show declining rural life expectancy. Even in this case, a more conservative estimate is showing stagnating. These differences existed before the pandemic and cannot be explained by COVID-19. And in fact, COVID-19 mostly just exacerbated some of these underlying differences. I attribute a lot of this to the diverging partisan politics associated with health policy and the welfare state in general. So at a federal level, if we just look at, I have no idea how that 1975, it doesn't look like that on my end. If we look at stuff like party manifestos and favorability towards the welfare state, what we can see is that the Republican Party is a global outlier on this front. So the Republican Party has not become any more favorable towards the welfare state since the 1920s. That is before we had a welfare state. But the Democratic Party has trended alongside the rest of the globe, including conservative parties from other countries. So at this point, in peer wealthy democracies, the Republican Party is a global outlier in its opposition to the welfare state and to health policy making and for citizens. If we look at the state level, we get an even clearer picture. So we can look at things like cigarette taxes. We can look at things like stand your ground laws. And what we observe are that the states that are more reliably Republican, or even states that have more recently shifted into the Republican Party, have drifted pretty considerably in their health policies relative to Democratic states. So I group states here. In the book, it's clear, a little bit clear why I'm doing this, in part because there's a debate that what's actually going on with this overall pattern is that the states that have always been sick just switched parties. And it's not actually about what the parties themselves have been up to. But if we look at states that have been in Republican hands for the vast majority of the last 30 or 40 years, we can see similar trends. And actually on some policy measures, it looks like these regularly Republican states led the way. The other reason that I like doing this is because most of our analyses or analytical tools for trying to get at the causal effect of party control are exploiting variation between states that are shifting. And that misses a lot of the action when many states have not shifted or have just become more ingrained in one party or another. And so what we would see is basically these states that have been in regularly Republican hands wouldn't appear in a difference in differences analyses or an RD analyses of party control. But regardless, we can see there are large differences. So here in this case, Republican states are going to have considerably lower cigarette taxes. They also have higher rates of smoking and lung cancer. Gun laws are perhaps where we see the largest difference, where Republican states have very permissive gun laws, whereas Democratic states tend to have less so. If we look at health outcomes, we can see there are some similar divergences. So here I have the percentage of the population that is uninsured at the state level. And on the right, I have firearm deaths per 100,000. What we can see is that far fewer individuals, lack health insurance in Democratic states, partly as a function of the ACA and the expansion of Medicaid. But also they were already a little bit less that way because they had more robust welfare states even as of 1990. One of the most stark changes that I observe in my work is with firearm deaths. So what we can see, there's been a lot of discussion by health professionals, especially in public health, about the increasing firearm fatality problem that is facing the US. what you can see is that for Democratic states, there really has not been much of an increase in firearm fatalities over the last 20 years or so. Instead, what's going on are that Republican states have experienced extreme spikes. So if we look at recently Republican states, that's mostly going to be states in the South. If we look at regularly Republican states, that's mostly going to be states in the Midwest. We observe similar trends actually with regularly Republican states leading the way. If we were to back out all of the change of the national, the increase in firearm fatalities at the state level, what we would see is virtually all of that is driven by the Republican-controlled states and not the Democratic-controlled states. So despite maybe what you might hear in some media reporting, it's not, the increase in firearm fatalities is not being driven by places like Chicago, it's being driven by states like Florida. And if we think of it as an urban-rural dynamic, what we can see is that much of the increase in gun suicides are occurring in rural areas. Much of the increase in gun homicides are occurring in cities in red states. So Jacksonville, Florida, for example, would be a place where you've seen a real uptick in firearm fatalities. The national firearm problem is a problem of state gun laws in major part. If we do try to do some type of difference in differences analyses, or we just do a within state analyses, what we can see are there are still pretty large partisan differences, although they're considerably smaller than what you just observe looking at the states, in part for the problem that I mentioned before. A lot of these states aren't switching back and forth very often. If we look at the percentage uninsured, if we look at premature deaths, if we look at life expectancy, we look at firearm deaths, the effect of unified Democratic control is pretty pronounced. So here I just have a 0 to 1 scale where 0 is completely Republican controlled, 1 is fully Democratic controlled. If we break this out by a chamber, like governor, Senate, House, we see virtually the same thing. If anything, this is just kind of creating an additive measure of that. So Republican states far and away are producing worse health outcomes for their voters. If we look at rural voters specifically, what we observe is that rural voters in many cases, or rural communities in many cases, are experiencing the worst or higher rates of these outcomes. So if we were to break this out, it's pretty difficult to do over time, state, rural, urban differences in most things, in part because measuring these things in a rural space is difficult. You have to have enough firearm deaths in a particular community, for example, for it to even have a measure of a firearm fatality rate. So that creates some year-by-year issues. But if we look at state-level estimates, when we do have such data, what we would observe is these effects are particularly large in rural areas. So that's the first part of my book, is basically showing that who you vote for has pretty demonstrable effects on your health, and that voting for Republicans has pretty negative effects on a state's health, especially in rural areas. We might think that that would lead individuals to vote for the Democratic Party if they're concerned about these outcomes. And in much of the literature, that's what we observe, right? People who have more social vulnerability of a variety of sorts are more likely to support Democrats. That was the case for at least most of the 20th century, for which we have the data, but that has changed over the last 10 years or so. So here I have data from the General Social Survey. In red, I have the percentage of people who report having poor or fair health. Red. In black, the percentage of people who report having poor or fair health. And the gray line, this is for urban, the black line for rural. What we can see is, as of about 2005, it was pretty equal numbers of individuals who reported having personal, poor, or worse health. Were supporting the Republican Party at about 40%. So as of about 2005, we have sort of our canonical understanding of things that a minority of individuals who are health vulnerable are supporting the Republican Party. There's some great work that basically said at this time, Republicans were the party of the wealthy and the healthy, and that's supported in large part by this data. But what we've seen is a real change in rural communities. So not only as the percentage of rural individuals in poor or fair health has increased, but we observe that the percentage of those that are in poor or fair health that identify as Republican has drastically increased in the ACA era. So since 2008, we're now upwards to over 60% of rural folks who say they have poor or fair health now identify as Republicans. This looks similarly regardless of how we think about what being in poor health or having health vulnerability looks like. So if we look at, instead of self-reported health, which has notorious problems, and instead we look at things like what type of health insurance they have, what we can see is that just about half of individuals who get their health insurance from a state-run exchange, who are on Medicaid currently or have no health insurance in rural communities, identify with the Republican Party. So in other words, the modal person in a rural area that benefits from Medicaid is a Republican. And that is not something that was the case up until very recently, and it has some perverse effects on our politics when this is the case. Importantly, this group of folks is not particularly supportive of Medicaid despite having benefited from it. So there's a long literature in political science. Paul's been a very big contributor in this space that talks about the role of policy feedback shaping people's attitudes towards politics. And the story that we observe for most voters outside of rural contexts is if you're benefiting from something like Medicaid, you're highly supportive of its continued existence. You recognize those benefits and you do what you can politically to fight for or politic for the continued existence of these programs. That's not what we see in rural areas. So in rural areas, what we observe is that that modal person that's on Medicaid in a rural community is a Republican, and their support for the Affordable Care Act is under 25% for every group. So it does look like there's still this canonical policy feedback effect where individuals who are benefiting from Medicaid are a few percentage points more likely to support the ACA, for example, than others, but it's not enough to put them into actually being majority supportive. And instead what we see is that the national partisan politics that surround the ACA, that surround Medicaid expansion, influence individual voters' perceptions of these policies. So the average rural person without health insurance or is on Medicaid is a Republican who does not support the continued extension of the benefits to people like themselves. Right? That's sort of a core takeaway here, which I think opens up a lot of questions that a lot of people have about American politics or have had for a long time, which is, why the hell is this happening? Right? How did we get here? When we go back 20 years or so, we can think about books like What's the Matter with Kansas? We're asking this original version of this question, but a variety of folks have tried to entertain what is going on here on the one hand, but others have, I think, tried to obscure the fact that this is actually happening. And if we look at the survey data, regardless of source, we see this general pattern of individuals who are benefiting are against things that they're benefiting from, which really, I think, opens up a variety of important questions. So I point to three factors largely. One is the partisanship that we've already talked about. Once you become an identifier with the Republican or the Democratic Party on things like healthcare, you mostly adopt the viewpoints of your party somewhat unthinkingly. So Gabe Lenz is here, right? We can think about his important work in this space, not here, but here. In the atmosphere, he's here. And I'm very much shaped by a similar perspective, which is that people actually don't know a lot about healthcare, in part because it's very complex. It's a difficult thing to understand. I always try to make clear that I'm not poking fun of these individuals. I have a PhD and study this full time, and I have a pretty hard time navigating the American healthcare system. So I think it's not that surprising that we would expect individuals to follow elite cues on things like healthcare. I wouldn't say that all policies are like this, or that all people are unthinkingly following their party lead, but what I show time and time again across the book is once you identify as a Republican, regardless of what that reason is, you're not supportive of benefits even if they come to you directly. And I think that that's a really important thing to wade through. There are two other mechanisms that I think contribute both to the Republican identification, but also the lack of support for these attitudes in general. One is drawing on Kathy Kramer's work, the notion that these disparities, that these experiences themselves may undermine support through a resentful mechanism, which is the worse things get, the less likely people in these communities see benefit from government, think of benefits from government, the less likely they are to support these programs, right? So it might not make sense to us that someone living in a community with poor health outcomes would turn away from government instead of towards it for health. But if we think of a simpler logic here, which is that things are bad in my community, I don't personally feel like I'm benefiting from this status quo, therefore I don't want any more of it, is basically the logic that we're working with. And if you've read Kathy Kramer's work, she's got a handful of quotes in there from rural folks in Wisconsin that really kind of drive this home, which is, I don't want my tax dollars to go up to go help other people. I want stuff to help me. And so I think there's a very simple blame logic here, which is the Affordable Care Act introduced lots of changes to the healthcare system, many of which were very helpful for rural areas, but some were not fully realized if you were in a Republican state. And for some rural communities, the outcomes themselves continued to worsen despite these policy solutions. And so those bad outcomes contribute to a resentful perception of the entire healthcare system and of government. So if we look at like an aggregate state level, this holds at the individual level, but it's a less pretty plot when I try to show that. If we look at aggregate levels of health disparity, so we can sub in literally any healthcare outcome for which we have reasonable coverage on rural and urban here. Here I have poor and fair health. If we look at the difference between rural health and urban health in a state, at the state level, and aggregate measures of rural resentment, what we observe is a strong positive relationship. That is, in states where rural health is demonstrably worse than urban health, those voters are substantially more resentful towards the government, towards cities, towards the Democratic Party. And so this is sort of a key argument of Kathy Kramer's work, sort of fleshed out further, which is people are viewing things in cities as, in some ways, correctly better off than what they're experiencing in their communities, and that is leading them to want to withdraw rather than support the government. And these attitudes are related to ACA support pretty strongly. So the more resentful an individual is towards cities, towards the government, what we observe is a real steep decline in ACA support. So this is sort of outside of partisanship answer one here, which is these outcomes, they're getting worse, but it's pushing people away from government because of their resentful blame and misattribution. The other is race. So, and the reason I call this place and prejudice rather than place or prejudice is that it does seem to be a little bit of both. And part of what's going on here is a resentment towards groups of people that rural whites associate with cities in addition to the disparate outcomes themselves. So here I just simply have individuals who score above average in rural resentment in the light gray and below average in the dark, or above and then below in the dark color, and their average ACA support by whether or not they're on Medicaid, whether they've received health insurance through an exchange, if they have private insurance or they have no insurance at all. This is like the dying of whiteness argument if you've ever read Jonathan Metzl's work. In essence, what we see here are pretty similar trends to the partisanship component of this, which is that yes, there does seem to be some policy feedback effect even amongst rural whites who have racially resentful attitudes, but across the board here, individuals who are above average in racial resentment are substantially less likely to support the ACA regardless of whether or not they're benefiting from it. So we have these three forces, partisanship, race, rural resentment, that are all pushing individuals to the right. That, at this point, may seem pretty intuitive, but quantitatively, that's less established, especially in this space. If we think about works like Thomas Frank, he really comes down saying that this has nothing to do with race. In fact, he draws on the fact that Kansas's history and Bleeding Kansas and a history of anti-slave efforts as like evidence and proof positive that Kansas is not racist, and therefore race has nothing to do with what's going on in these communities. But if you look at these data, what you'll find is that your typical rural Kansan has the same rural resentment score as someone who lives in Alabama or Georgia or Mississippi. Maybe that wasn't always the case, but Kansas has changed. And I think it's worth highlighting that, as Frank notes himself, Kansas is about 90% white. So we're talking about a very white space, and it makes sense that race would be important for shaping not only people's attitudes about the Affordable Care Act, but also about place in general, right? So these two things are intertwined with one another. I don't necessarily think that we can separate resentment oriented towards the government and towards cities fully from people's racial identity. So these are all just descriptive trends. You might not want to take my word for it. So I ran an experiment. Well, two experiments. I'll show you the most simple version of this, where I made up a fictional health policy, basically a policy that would be so liberal that any liberal state would actually not even be able to afford it. And I did so for two reasons. One, I want to show and convince people that this isn't just that rural folks are conservative, right? So it could be the case that rural individuals are conservative ideologues and they're just against government in general, and that wouldn't be that surprising. It wouldn't be that surprising then that perhaps they're not supportive of these things. But the other thing that I want to accomplish with this is that there's at least been some notion that elites have a limited role in shaping people's attitudes. This is sort of a revisionist American political behavior take that I think is growing in some spaces, and a take that I disagree with strongly and want to demonstrate that part of what we've observed in that movement are when we look at surveys where we ask people about the Affordable Care Act, we don't observe a lot of movement because elite cues on the Affordable Care Act are omnipresent. They haven't disappeared. We know how the Republicans and the Democrats feel about the Affordable Care Act. So when we think about something right off the top of the head, we can get people that's brand new, they've never thought about it before. We can get their knee-jerk initial reactions to the details of the policy. We can tell whether or not they're just less supportive of all things related to government as a core ideology, or what's going on. They're hearing cues in the media or having information that might suggest that there's some disparity that drives the lack of rural support. So in this case, the policy was essentially, I believe this one was a health debit card, where basically every member of the state would get $5,000. It was either $5,000 or $1,000. It's been a minute since I ran the survey. Health debit card. Think of it as sort of like a health savings account card, like a flexible health savings account for every person in the state. And the vignette says everyone is going to get this. Everyone. But I add in the control condition, that's all they hear are the details of the policy and that every person in the state will benefit. For the first treatment condition, I add at the very end of the vignette, it says people who are in poor health, have medical debt, or chronic health problems will be most likely to benefit. Full stop for the control. For the helps immigrant treatment, I add a comma and say, this will be especially beneficial to immigrants. For the helps minorities, that subs in, it'll be especially helpful for minorities. And then for rural, this will be especially helpful for rural voters. And what we observe, so here I have the average treatment effect from this experiment, just comparing these two frames to the control condition. And then for has health problem, these are people who in the survey before the treatment said that they had a chronic health problem. The has medical debt are individuals that say that they are personally in medical debt. The has poor fair health is they assess their health to be poor fair. And then the final one is they don't have health insurance. So these are all assessed pre-treatment, basically getting at, are these trends that we're picking up in the CES applicable to people who would actually benefit from these policies directly? And if we tell them directly that they're going to benefit, does that do anything to counteract these attitudes of anti-minority groupings or marginalized populations? And what we really see are not a lot of differences across the conditions. So if you tell a rural white individual that in addition to the policy helping them, so this is in addition to helping them, it will also help immigrants, this is enough to shift support from majority supportive to majority disapproving. When we look at the same thing for helps minority groups, we observe a little bit of a smaller shift, but still statistically significant shift away from the baseline. If we tell them that it's going to help rural people specifically, that does not really move attitudes very much. And so we have an asymmetry here, which is when elites call attention or the information environment calls attention to the fact that individuals who are racial or place-based outsiders, which is in the second experiment, are likely to benefit is sufficient to undermine rural support, even amongst the people who are most likely to benefit. In fact, most of these estimates for helps immigrants or helps minority groups are larger numerically than we observe for the on average treatment effect, although their confidence intervals overlap. And so we don't want to necessarily say that they're distinguishable from one another, but it does look like the attitudes are moving people by similar amounts. And there aren't really large baseline rate differences in support for the control group. So we might think that part of what's going on here are that the individuals who are in medical debt, they're just much more supportive of the policy on average. And so even though the Q is moving people down, it's actually not so much the case. They're a little bit different, but overall for each group, just telling someone that an outsider will benefit in addition to them is sufficient to pull their attitudes down. Yeah.
A quick clarifying question. The scale here should be thought of as what's the?
These are it's categories on like I think it's a 0 to 3 scale. And yeah, that's that. I don't think that I rescaled anything beyond that, but yeah. So I followed up on this one where I added party cues to see, does it matter who's providing this information, Democrats or Republicans? And I also switched out the helps rural to helps cities to see, well, let's draw attention to a place-based outside group because the helps rural is not really moving. Perhaps they're already integrating that information in. What I observe is Democrats saying that a policy will help immigrants really moves people's attitudes down. That outgroup information is taken as proof positive that a policy is not going to help them. Republicans saying that a policy will help immigrants in addition to them does not depress attitudes, right? So that suggests that if they hear from a trusted partisan source that a policy is going to help somebody else in addition to them, it has a different effect than what we observe if an out party says such a thing, right? And that's, I think, pretty critical for understanding the mechanisms here. Republicans can get away with lots of different policymaking and can even do equitable policymaking if they want to and face little voter backlash for doing that. But if Democrats are engaging in this, what we observe are pretty strong pushback. For what it's worth, if we want to think about are these people just against these policies in general, the control condition support for the policies is just above that unsupportive benchmark. And so what we could say is like without information that the policy is going to help an outside group, rural voters are actually okay with most of these things. It's not so much a fully conservative opinion. Yeah.
I feel like one way to think about this is that the kind of telling people, signaling like, is this a liberal policy or conservative policy?
For sure. Yeah, so I have done some different work, like in the control condition, it's like, it doesn't seem like people are intuiting that it's a democratic or liberal or policy or whatever, but this information is enough to get them to view this as something that would be not beneficial for them, or I think that's totally fair, that it's like, okay, now I know that the Democrats are for that. In the party control condition, or party Q experiment, the fact that Republicans can draw attention to how the policy will help an immigrant or how the policy will help cities doesn't move attitude, suggesting that it's not so much the information that they are doing exactly what you're saying, which is that when they hear that this information is going to help immigrants, even if I don't tell them the Democrats are saying that, there's some intuition that they have that that's what's going on with the policy, or that Democrats might be favorable for it.
But I mean, the fact that you get that tiny Republican does indicate that, because it's just the Republican signal is like a clearer signal
Yep.
than the signal from immigrants.
Well, the Republican signal, I think, is providing something different, which is that it's, in addition to what you're getting at, it's also that the policy really will help you when they say that it's going to help them. And so they're not so much concerned about the fact that these other groups are going to benefit, because Republicans saying it's going to help you and these groups doesn't move attitudes. It's just when Democrats do that. And so I do think that some of what you're talking about is going on, and there is that intuition happening. And there's some other work that suggests that that's what people do when they don't know. They sort of fill these details in themselves. I think I saw another hand go up. No, okay, we'll keep moving. So that's experimental evidence. And the Party Q experiment shows some similar things. So it shows that Democrats being for something just overall with no new information reduces support. Republicans being for something doesn't really move attitudes. So I think that suggests that there's a real partisan angle to this in addition to the information. In the back half of the book, I do 3 case studies using unfolding healthcare crises to try to document some of these things sort of in the real world outside of public opinion data. The first one is the opioid epidemic. The second is rural hospital closures, and the third is COVID-19. And each of them, what we see are this similar pattern of the worse things are for rural communities, the less supportive they are of Republicans, the less supportive they are of healthcare policies that might help their plight. In part, I call this sort of the rural health spiral, which is the worse it gets, or the information that suggests that others are benefiting at their expense, the less supportive they are of measures that even will help their own communities in a way that undermines support over the long run. So since 2005, there have been dozens of rural hospital closures across the US. If we go back to the early 90s, it's been about 200 rural hospitals have experienced either a closure or partial closure or being converted or merged into another system. Prior to the Affordable Care Act, what we observed was basically parity between states that would later expand Medicaid and those that did not in their number of rural hospital closures per year. It was about 5 in both kinds of states each year from 2005 to 2012. These are complete closures. If we look at there's other definitions of hospital closures that account for the loss of particular services rather than the closure of the hospital in general. But overall, there's really no difference, right? The states that later expanded Medicaid did not. The states have demonstrably higher or lower rates of hospital closures than those that did not. So what's fascinating about this is that most of the aspects of the Affordable Care Act don't start taking place on the policy level for individuals until about 2014. But the announcement from states, that the Supreme Court decision that allowed states to decide whether or not they would opt out of Medicaid was in 2012, and states announced their plans early on, right? So what we see is that if you work in healthcare, you'll know that hospitals don't make decisions on a knee-jerk basis. They're planning out their finances over years and years and years. So when these states start to announce that they're not going to expand Medicaid in 2012, rural hospitals start to close at higher rates in the communities of states that did not expand Medicaid. So the expanded Medicaid, this is just goofy here, but the line that goes up are the states that do not expand Medicaid. The line that dwindles down are the states that do. The reason these closures are occurring is multifaceted. So on the one hand, most rural communities aren't able to support their hospitals financially. There are just too few people with health insurance or with disposable income to support their hospitals. The economy of hospital organization has changed pretty significantly over time, where there's more private equity, large corporate interests that are merging hospitals into urban cores. And so a lot of what's happening here, you might say, is somewhat organic. But Medicaid's really critical because the primary financial reason that hospitals close is due to uncompensated care. So due to EMTALA from 1986, hospitals are required to provide relevant health provision to an individual who shows up in an ER up to the level of basically appropriate care, which has been undefined. It's a Supreme Court issue currently for other reasons. And this issue basically launches this policy launches in some ways the uncompensated care problem for hospitals. So individuals can come into the ER without health insurance, without the ability to pay, and they must receive care. And the federal government does not reimburse hospitals for this. State governments largely don't reimburse hospitals for this. This is just sunk costs for hospitals. So once EMTALA is passed, a lot of rural hospitals start to financially struggle. Many of them were already financially struggling, in part because the federal government financed most rural hospital construction coming out of World War II with a policy known as the Hill-Burton Act. Hill-Burton just built hospitals kind of willy-nilly without much of a thinking through whether or not those places could financially support them. Initially, it was highly exclusionary. It only went to white areas and not any areas that had high black populations. It had a separate but equal clause, which was a move removed from the policy after the Civil Rights Act and after Brown versus Board. But the hospitals were built to fail. Right, in many respects. And EMTALA creates a real financial problem for most of them because now we have a whole lot of people showing up to the ER and they cannot pay, and someone has to pay for that. Medicaid expansion, reducing the number of people that didn't have health insurance really helped a lot of these hospitals. So a lot more hospitals were planning on closing in the future, but were able to not do so as a result of expanded Medicaid. In the states for which Medicaid expansion never occurred, we really have some financial problems. A lot of these places are losing their hospitals at rapid rate. If you look at reporting from the hospital industry, as much as a third of the still remaining open rural hospitals are in jeopardy of closing in the coming years. So this is still an unfolding problem. To get at the politics of this, I took data from the CES and merged it with the location of rural hospital closures across the country. Here is just sort of a visual representation of how I do this. We have a closed hospital here in Sumner, Tennessee, which is right on the border of Mississippi. What we can see are the CES respondents jittered around the location of the hospital. They don't give you their actual addresses, so this is just their pretend addresses for now. What we can see is that the CES interviewed about 20 folks in this community and the waves that followed the hospital closure. I think it was 48 overall in the entire history of the CES survey. What we can see is once this hospital closes, these folks have to drive pretty far to get to their next open hospital. So in blue, we have the next closest remaining hospitals. It's about double the distance for most of the folks that are in this community. The closest hospital to most folks is this hospital right here in Corinth, Mississippi. The problem is in Tennessee, if you're benefiting from Tennessee's Medicaid program, TennCare, you're not allowed to get health care across state lines. You have to go to a hospital in Tennessee. And so for people who are better resourced, have more money, there is a hospital that's about 30 minutes away, but for everybody else, the closest hospital is 45 minutes to an hour, depending on traffic. So we have a real expansion in the distance that individuals face to get to healthcare. There's an old adage in healthcare that time is tissue, and the further away you are from hospital when disaster strikes, the more likely you are to suffer fatal or more severe consequences from things like snake bites, to strokes, to COVID-19. The further you are away from care, the worse things are for you. So given that state Medicaid decisions seem to be so consequential to this, we might think that this would lead voters to blame their state Republican governments for not having expanded Medicaid and maybe be even more supportive of the Democratic Party due to the policy fix, right, to the problem. But that's not really what we see. So in communities that lost their hospitals, individuals, this holds at the county level, it holds with a variety of different methodological choices here. Individuals who lost their hospital shifted their support to the Democratic or to the Republican Party by 5 to 10 percentage points, depending on how we estimate this. We don't observe backlash against the Republican governors in these states, so it's not as if there is an incumbent penalty, it's a Democratic penalty. By similar amounts, support for state Republican governors increases after these closures, right? So this is where we can start to see some of the mechanics of the rural health spiral. The worse things get, Republicans are rewarded for those experiences, even when those experiences are caused by Republican policy choices. So when we look at sort of mechanistic attitudes, what we can see are some clear explanations for how this happens. So looking at hospital closures that occurred under Obama and hospital closures that occurred under Trump, both sets reduced support for the ACA by similar amounts. So if a community lost its hospital relative to similar matched communities, I probably should have mentioned that detail, we're comparing the most similar communities in these regions that did not lose their hospital with those that did. What we can see is that ACA support declines consistently in both, but governor approval increases in both, and presidential approval moves in opposite directions, right? So when Barack Obama is president, if you lose your hospital, you blame Barack Obama, you blame the ACA, and you reward your governor. When Donald Trump is president, you blame the ACA and you reward your Republican governor and you reward Donald Trump, right? And so even when Donald Trump is president, you see this sort of health spiral mechanism in play. That the worse things get, the more likely these voters are to support Republicans. We can see this with the opioid epidemic. There are similar trends. Voters responded to Trump's rhetoric and emphasis on the epidemic, not the policy realities. In fact, the ACA had brought down opioid prescriptions and prescription-related mortalities pretty significantly by the time the 2016 election happened, but voters responded to Trump's rhetoric. If we look at COVID-19, what we can see is there's virtually no relationship between people's state level policy decision making about whether or not their governors closed things down early or how long it took them to close them down. What we observe is that people that caught COVID that lived to vote in 2020 were more likely to support Trump if they lived in rural areas. And so over and over again, we have pretty significant evidence that these bad experiences are pushing people rightward and away from government in rural areas in particular. So some key takeaways here that Republicans pass policies that are harmful to everybody, but perhaps especially to rural voters. But through appeals to shared racial and place-based resentments, by contextualizing the experiences that individuals have as government failure, we observe these sort of asymmetric effects of the government failing. Resentment about these outcomes and towards the government pushes even non-Republicans in rural areas rightward. So if we look at people who identify as Democrats, people who identify as independents, we see a similar shifting in these attitudes following some of these experiences. And this leads to what I call the rural health spiral. The worse things get, the more resentment is felt. Government is trusted less to solve problems, and Republican support builds in these communities despite, in some cases, because of the effects of their rule. This creates what I call an electoral moral hazard, which is that the fact that there's supermajority Republicanism in many of these communities on its own makes it to where accountability is highly unlikely for most of these experiences. But there's actually a built-in incentive structure here where Republicans are gaining votes from breaking things, and therefore they may be incentivized to break things even more. And that is a real problem when we think about our democracy and how it functions, at least in these rural communities. Blame is misplaced, and it's leveled at the government for good reason, but at the wrong people and for the wrong reasons potentially. And with that, I would love to hear your thoughts and questions. Thank you so much.
Well, thanks for that really cheerful, appropriately cheerful presentation. I have a bunch of questions, but I think I'll turn to the audience and see if people have questions before I do that. Sam.
This is really, really, I have a ton of questions also and thoughts, but it's working. Yeah, I think it's working. Now it's working. So it wasn't on your final slide, but the kind of what I kept thinking of is the fact that the Republican Party has become the anti-system party over this period. So when you have an anti-system party and you have things like breaking and not working, and you have like that aligns with the messaging of anti-system. So
Yeah.
I'm curious how that's been brought in. But then my like analytical question is, it seems like a really important comparison for the argument would be rural voters in Republican states to rural voters in Democratic states like California.
Yeah.
Because if the argument is right, then we should see less of a dip in Democrat support in rural areas of Democratic states among like voters. So I'm curious if you've done that analysis or that if that like interpretation is, you think that's correct?
Yeah, those are both great questions. So on the last one, if you look at, so it's not just red states that have lost hospitals. I was actually just talking to someone before this started about some hospital closures here in California. There have been a handful of hospital closures in California outside of Fresno. If you look in those communities, you do not see the same large shift following the negative experiences that you observe in the red states, although there is somewhat of one. It's basically what I would see is like a 5 percentage point dip in Tennessee, for example, following a hospital closure. In California, it might be like a 1 percentage point dip. Why that is hard for me to wrestle with, in part because there are so few of these bad outcomes that are occurring in blue states that it's difficult to get a real handle on how generalizable the experiences are. But I view it as like a phenomenon that's occurring everywhere, but the degree to which the shift is rightward is just far more significant in the Republican states than it is the non-Republican states. But the outcomes are also a lot worse and more frequent at that point. So I think that's what the data look like. Why that's necessarily the case, I think, is an interesting thing to think about, in part driven by media differences, in part driven by party organization differences. One of the things that's going on at the same time in a lot of these states is the Democrats have just stopped campaigning altogether. And there's larger rural news deserts that exist in these spaces. And so what I think is happening to explain some of these differences is a hospital that closes in California, there might be local news actually there to report on what's happening, and that might minimize some of the rightward drift. But in a lot of the communities of the South especially, there's no reporting actually that's going on. Instead, what you see is like an announcement on Facebook. And I read a bunch of these posts from different groups where it's like, this hospital closed, and you can look through all the comments, and over half of them are like, this is Obamacare, I blame Obamacare. And you can sort of see that there's not a pushback. There's not an information mechanism that might be minimizing that drift, but the point's well taken. I think some of this is a nationwide phenomenon that's just a matter of degree. Your point about anti-system politics, that's exactly where my head is that some of this is that the Republican Party, I don't call it anti-system, but I do sort of couch things in terms of Reagan branding the Republican Party and the government as the problem. Basically, that you can point to the party or point to the government as being the problem, and then if you make it have some problems, voters are going to, over the long run, see Democrats as the party of the government that's doing the things and Republicans less so. And I do think that that's a pretty critical mechanism for all of this, is that when voters blame the government, they just associate government with Democrats, and Republicans have successfully rebranded themselves as the anti-government party. So anything that might be the government's fault, even under their rule, is the opportunity for voters to be pushed rightward. And so I do think that there is an element of that is tied up into the anti-system or populist politics, if you want to call it that, for sure. Yeah, good points.
Thanks for your talk. I found it very compelling, especially the moral hazard component. And I was wondering if you could talk a little bit variation, thinking back to Republican-controlled states that expanded under the ACA,
Yeah.
or even conservatives today that are concerned about cuts to Medicaid. Is there any reward for them to support robust policies?
Yeah, so that's a great question. It does look like in the Republican states that expanded Medicaid that support for those governors is just higher in general amongst independents, Democrats, and Republicans relative to other Republicans that are doing these things, but it's still sort of baseline on average, just more in favor of Republicans in all of these rural communities. I do think that what you observe in a lot of that way is to your question, is independent voters are the ones that are likely to reward such maneuvers. But there's an asymmetry here that I think is worth wrestling with, and one that I'm still wrestling with, which is that at least when it comes to rural voters, there's pretty clear evidence that bad things push people rightward, but there's not a lot of evidence that good things pull them leftward or make them more supportive of such policies. There's some good work from Jake Jarez and others about Trump's trade war last time and the policies that were enacted for helping farmers overcome the financial difficulties that they faced. And farmers were really supportive of those policies, but it did not move their politics at all. And so I think that that's one of the other asymmetries here, which is that it's very easy to level blame in the abstract, but also directly with the Democrats when things are bad. And I think that that's a key mechanism that's happening. But Democrats have a hard time getting rewards for themselves. Republicans, not so much, actually. I think they're sort of already in part like bumping up against a ceiling of support in some of these places, but that is a little bit of a difference. One thing that I've been working on is that Biden administration launched all of these EV factories and battery plants and stuff over the last few years. A lot of them were in rural areas. A lot of them have brought thousands of jobs to these rural communities, which we might think this is going to be major policy feedback effects. This will be great. That is not what we observe. There is virtually no relationship between these EV factories and rural support. There was no relationship between increased rural incomes or decreasing unemployment during the Biden administration and support for Biden. If anything, rural communities just kept drifting. And that tells me that some of this is just happening. But where the outcomes sort of fit in is that they just exacerbate the trend and make certain communities more susceptible to the viewpoint of anti-system politics, to use your phrasing, but that there's something else happening here that's just broader, and that the politics of place and race are just pushing people that direction. And I really do think the media is, or the lack thereof in some of these communities, is pretty critical for understanding how that would happen. When I've done some focus groups in these communities, virtually no one has any idea like the federal government's role in the EV factories. They just think that the companies themselves identified a labor pool that was great. They like to pat themselves on the backs and say, we're hardworking. These companies must recognize that we're a great community for this. They must love our town. And then when you tell them later that it was a federal investment, it's almost like you can see some of the blood rush from their face, and they're like, well, now I don't really like that so much. And then if you go to the communities where the companies are Chinese, for example, there's outward hostility towards the companies even opening, and people will just reject the jobs altogether. So in Big Rapids, Michigan, for example, not Grand Rapids, there is a Big Rapids. People think that I make a mistake when I say that. There is a community that was getting ready to get about 1,500 jobs for an EV battery plant, and they killed off the plant because of, in part, xenophobia, I think, towards the Chinese-owned nature of the company. And so that tells me that the prejudice part of this is pretty important for understanding why the outcomes might not be the key mechanism here for a lot of this. Yeah.
Yeah, for the recording. Okay. I have one maybe simple question, but I think it's going to be difficult to answer, but depending. So you touched on two mechanisms. One is about policy complexity, and people generally don't know much about policy, just so how to navigate US healthcare system. So that's one piece. And the other one is people hate some outgroups, including immigrants, racial minorities, and also Democrats. So that's other piece. But what I'm wondering is whether there's a kind of trade-off. So the first one is very hard to get it. And the second one is very easy to get it. And most people is kind of going back to Kahneman system 1, system 2. If there's easy path, they choose it. So for their mental representation, okay, this is how it works. So they choose it and they ignore the other piece, which is a policy. And they may explain why we don't see the usual policy feedback effect, because they have other option, which is easier. So I'm just wondering what's your reaction to that kind of?
Yeah,
thinking?
no, I think that's a great point. I basically pitch it in the book as scapegoats being offered instead of solutions, and that the scapegoats feel good when things are bad and your community isn't the way you want it to be, or your life isn't the way that you want it to be personally. Scapegoats feel good and are easy to understand. Republicans in many of these places have very simple arguments that it's those people over there that are getting the things instead of you, and that makes a lot of sense to individuals who aren't being given much information contrary to that. And when the contrary argument is, well, actually the Affordable Care Act and expanded Medicaid reduced uncompensated care loads for your hospital, and actually that's why and so they're different arguments, and I think that is a real critical, another asymmetry here, which is that if there are benefits to raising the salience of social outgroups or groups that individuals view more negatively as scapegoats, it's really easy to move people in that direction, and it's very hard to bring them back. Part of the rationale behind the experiment I was trying to look at, if we could think about like some of us from Heather McGee's work, logic to pull people back. And I do think that works in some ways, but it doesn't work that well with rural people. And rural white folks in particular, are pretty susceptible to the logic of scapegoating rather than solutions for their problems, but also information that suggests that they're wrong. And I think that's exactly the key dynamic that's happening here, is that stuff's hard to figure out. It's a complex world. Policy is complicated, but scapegoats are really easy to understand. And in a lot of these communities, it's not just that it's easy to understand, it's that that's all they're really hearing. So in a rural area, you don't learn about politics from your local news because it's really far away probably. And what you're actually learning about politics from are your neighbors in a large respect. So are in some ways like talk radio, church, these other sort of institutions that provide conservative information in different forms. I think Facebook, social media, et cetera, has been a real issue in some of these rural communities, because it's not that all rural voters have insanely conservative or insanely xenophobic attitudes, but the loudest ones do. And the loudest ones posting on Facebook the most often believe things that are incredibly right-wing and incredibly prejudiced. And I think what happens is, for a lot of folks, even people that don't necessarily have super racially resentful attitudes, for example, that's just what they learn. That's just what they see. And they maybe don't think about the fact that I'm against the ACA because I don't like these other groups. They just sort of wade through this as these other groups must be benefiting and at my expense, even if that's not actually the case. But that's a great point. Yeah, Omar.
Your last comment, I mean, this is all amazing, and I want to emphasize one thing that I admire, which is that like so much of political science is focused on sort of relatively like, can we get some modest effect, and like talking about adding months of life is like material really matters, right? And so just want to underline, like, I think big picture, how important these kinds of outcomes are. Your last comment sort of raised the possibility that like this is also overlapping with the education divide in ways. And so I just wanted to invite you to talk about that. And if there were any in your case studies is a totally separate question. But on your other last comment suggested, like, are there stories where we see people sort of connecting like the potential benefits of the ACA to their local outcome? I just wonder, are there any examples you've seen that suggest some variation?
Yeah. So there's definitely variation. Rural communities that are better off materially, economically, et cetera, are less shifting in that direction, although there is a general trend and a general gap. So I do think that there is a world where when things are better, and even if that's organic, the perceptions of resentment or even things like racial attitudes are just less present in people's minds. So there is some evidence that the reverse is true, that the better things are, the less likely individuals are to think through things via scapegoating. And I do think that that's critical to point out. And I think just because things like the EV plants don't have demonstrable electoral effects in one election doesn't mean that there's not some long-term gain for those communities, and that bringing people out of hardship doesn't have some benefit. I do think that that's the case. I think my view on that is that in the short run, Democrats need to adopt a view of policy without feedback, which is like, do good things because you believe in them and because you think people that are suffering should just not suffer, and electoral context be damned, like eventually people will wake up. And I think that there's some usefulness to viewing things that way. In terms of the education divide, I think it's a pretty important background feature here, but I think it's complicated. So part of what I think is missed in a lot of the education divide discussions is that part of the rural aspect of this, or the resentful aspect of this, is that individuals with higher educations move out of their communities into cities, and that is going to leave two types of phenomenon occurring at once. One is a hollowing out of potential Democratic voters for these communities, but the other is that the people that are left behind are pretty resentful about their declining economic opportunities, but also about the fact that people that they love have moved away. I say this like with firsthand experience. I'm the only person from my family in my small town in Kentucky that doesn't live in that same small town and hasn't always lived there. And I can tell you plenty that my mom doesn't like it, and she's pretty resentful that I'm not there. But that's like, the people that are there, they love their communities. They care a lot about where they're from. And when things go wrong, it really ticks them off a lot, like it does to most people. And I think what's happening for a lot of people there on sort of the more commonly discussed aspect of the educational divide is that a lot of people in these communities are ill-equipped to wade through the complexities of political life that we now face, and are also more susceptible to scapegoating. And I think that that's really critical. You know, we've a finding in political science that hasn't really changed very much from Herb McCloskey's days here way back, was that people that are not educated are less committed to democracy. They're less supportive of multiracial democracy. They're less able to wade through complex policy matters. And so I think just the fact that rural communities are places where the folks without college education, that rate's just higher. And a lot of the loudest people in these communities are older individuals who did not go to college. It sort of just spirals out of control in some ways, where people are learning from individuals who aren't particularly well equipped to navigate these things, and there's a self-interest in perpetuating the scapegoating. So I do think that the diploma divide stuff is right on, and I think it explains part of what's going on in these communities, but it's a little bit more subtle, and the mechanisms are slightly different than just people go to college and they're liberal, and people that don't go to college aren't. I think there's multiple ways that that's sort of contributing to rural politics.
Yeah, go ahead, John. I'm going to put myself next in line, though.
Okay. I was curious about the distinction that you made within the Republican states, and if I was recalling correctly, there are stably Republican states and more recently Republican states. And what I thought was striking was the outcomes were worse for recent Republican states.
Yeah.
I guess if you could frame them as sort of purple states. And in another graph, you also showed that those states have higher rural resentment
Yeah.
from the graph where there is higher interstate disparity in terms of political support. That probably indicates red states with blue cities.
Yeah.
And I was wondering what would account for worse outcomes like uh, less tax towards cigarettes or less healthcare support that also leads to higher racial resentment, higher rural resentment, and also lower support for health policies. So like maybe what's different between Ohio and Pennsylvania versus maybe Mississippi and Kentucky?
Yeah, so that's a really great question. And part of the reason that I divided things that way is because the South has always had demonstrably worse health outcomes than the rest of the country. Histories of racism, very limited health infrastructure or infrastructure in general, low government capacity. These things have always contributed to states like Mississippi, for example, having the worst healthcare outcomes in the country. And so if we just looked at like the average outcome between Republican and Democratic controlled states over time, we would see the same sort of massive fanning, but part of what's going on there is a bit deceptive because what's happening are the states that used to be Democratic in the South were already unhealthy and they switched to being Republican. And so that would give you a little bit of a sort of, I think, misguided view of what's happening in these communities. The reason I like to plot things that way is to show that those states got worse. So it's not the case that they stayed the way they were, which was already pretty low quality in terms of health outcomes, is that those states got way worse once they became Republican states, which for most of those units are from the 90s on. So when we observe a lot of the big decreases or increases in some of these outcomes that are bad, it's after Republicans take control. Things were already bad, but they got worse. But those other states that are like, for example, Kansas, to return to Tom Frank, they've always been Republican, but their outcomes have gotten a lot worse over time. And a lot of that has to do with some of the cuts that were made under like Sam Brownback, for example. And so we observe, I think, parallel changes in these states that on the one hand would be obscured if we were excluding the states that never changed partisan hands, but on the other hand would probably be a little bit misguided if we looked at just the change there. But there are some real differences that I think are critical for understanding these things. One is that you said, what's the difference between Ohio and Mississippi? Well, a lot of what's going on here is that health outcomes are really, really, really bad in Mississippi for rural communities, period. And if we step away from, I'm talking about rural white voters. In fact, most of the worst of rural health disparities are experienced by rural black communities and by rural black individuals and not rural white individuals. But rural white health the difference between rural white health and urban white health is also the largest in the South. And so what we observe are sort of cross-racial health struggles in the South and the Midwest. What's interesting about the Midwest anyway is that the health of Black Americans in the Midwest is also worse in cities. And so the gap between urban and rural in a place like Iowa, for example, for Black Americans is smaller than the gap we observe between urban and rural Black Americans in Mississippi. But the outcomes themselves are just demonstrably worse in the South, and they have been for a long time. The problem is, in my view, that those outcomes have been made worse by partisan control. And I think it does highlight how much of what is going on in some of these spaces is that rural white individuals have it better than rural Black individuals, and that contributes to their hesitance to support some of these policies for racial reasons and for status concern reasons. It's basically social hierarchy that rural white individuals have it worse than urban white individuals, but they do have it better than rural people of color, and that contributes in some ways to the lack of urgency to do anything about the problems. I think economically is the other thing, and I'll just say 2 seconds, is that the South is just poor. And that's one of the big differences between Mississippi and Ohio, is that there's just more material wealth in Ohio than there is in Mississippi all around.
So I guess I'll give myself the last, actually 2 questions. And I wanted to start just by echoing what Omar said. I mean, I think this is really exemplary research. I mean, I think the combination of care and creativity to address something really important, like it's just really impressive. And so, but I wanted to ask you about this electoral moral hazard framing, which of course, like any place where this is true is just incredibly disorienting, I think, for most political scientists to think about. Like so much of the way I think we think about politics, like if you do things that are helpful to people, that should be politically rewarded. And if you do things that are really hurtful to people, that should be politically punished, you know, at least by those people, right? And so once you throw that out the window, it's a lot to get your head around, and it has, you know, very, very big and disturbing implications. But so the 2 questions. So one is, so even though I think your research really highlights the importance of elites, you don't talk very much about elites in it. And I'm just maybe, you know, pushing you beyond, or maybe to the edges of the research that you've done. But like, do Republican politicians know this? Like, do they know that when they cause this kind of damage, it's actually going to help them politically? Or, you know, have you come across anything that, like if they don't know it, then you shouldn't publish this, right? But I know, I'm just curious whether you've come across anything about kind of how elite decision making in those states operates that would speak to that question. And then the question about the Democrats is like, well, what do you do about this, right? And so you started to give an answer about this a second ago, which was sort of, well, you know, do nice things even if it doesn't have a political payoff. And, you know, which is a lot to ask of a political party. It's a lot to ask of elected politicians and those who are trying to elect politicians. I actually do think the Democrats have done quite a bit of that. But some of my research with Jacob suggested that's the case. But I'm wondering if there's like another thing. To me, what you're saying points to something else, right? Which is, you know, at least over the medium run, it makes a difference whether you lose 80-20 or whether you lose 70-30 or 65-35, right? Just in terms of changing the kinds of conversations and understandings that might happen in these spaces. So maybe, you know, maybe the politicians aren't going to do this because they don't really care whether they lose 80-20 or 70-30, but groups that care about this kind of stuff that are maybe affiliated with the party and can think more long term, they might, you know, so I don't know, I'd just be interested in what kind of advice beyond do good things and don't worry about whether it helps you politically, you would say.
Great questions. So I don't have like smoking gun evidence that like that Ted Cruz said this or something like that, but I think you can view a few policy decisions in this way that would suggest that they are at least somewhat aware of it. At least the dynamic, which is that if the Democrats are in the White House, it's worth sabotaging things, even for their own voters. And so some examples that I think about are Greg Abbott in Texas. I don't know if this made attention out here or not, but he basically shut the border down for commercial like traffic during Biden's term, and this had like demonstrable negative economic effects for companies, for people in Texas, etc., and seemed to be doing so to try to intentionally sabotage things. And the way that he talked about it as was pretty consistent with that. I think you can probably put his decisions to fly or bus immigrants to democratic cities as a similar maneuver of trying to upset the political balance in harmful ways, though maybe subtly different. I think probably the most glaring thing at the federal level that revealed this was Mitch McConnell's statements right after Barack Obama was elected, that he was going to make sure that he was a one-term president, whatever that meant. And so I think we normally view that as, I'm going to obstruct, judicial nominations. I'm going to keep this policy agenda from happening. But I think at the state level, that spilled over into people's notions about whether or not they would expand Medicaid. And you can see quite a few quotes from Republican governors, either that they were running for president or wanted to run for president, saying like, I rejected that. I don't care what it's going to do for people. I think most of the time it's couched in a, this is bad budget-wise. But I think for many of them, it was a badge of honor, despite whatever good could come from it. Bobby Jindal, for example, was like really proud of having stood against Medicaid expansion and used that as part of his political pitch. So I do think that there's some evidence that state governors see the possibilities of sabotaging things while Democrats are in charge and that they benefit from it, but no real, I'm out loud saying that. Your point about I shouldn't publish this, I do wrestle with that a lot, which is like, do we want people to know that this is happening or capable of happening, even if it is happening? And I still wrestle with that a lot. I care a lot about these communities. I grew up in a rural area. For me, I view it as like, maybe there's some way some person can snap out of it if they realize that they're being led in this way to their own demise in some cases. But, I'm nervous that I am highlighting something that's probably not a good thing to draw attention to, although I don't think that they need any help from me figuring this out and that they're on this path already. So, I don't think my little political science book is going to do very much to upset what they're already doing. Your second question about what can be done. So I think there are a lot of things at the margins that can be done. One of them is that this might be surprising to some of you. Maybe this is just pretty normal information, but about a third of rural counties in the US don't have a Democratic Party organization. And there are almost no counties in the country that don't have a Republican Party organization. And this is not something that has always been the case. It's something that's become the case since Trump was elected. Democrats are running out of rural communities rather than to them. Is that bad? Like, on the one hand, there's an argument that that's an efficient allocation of your campaign resources. You are hunting where the ducks are. The voters that you're trying to get to are in these populated areas, and investing a bunch of energy to try to win over an extra 5 to 10 percentage points of the rural vote, which in a small community won't mean very much. Maybe that's not so important, but I think given how close a lot of these places are, so for example, Georgia is one of the states that has like the highest percentage of counties that without a Democratic Party chair. Now they got a lot of counties, so that helps make that happen. But if you add up all of the counties that lack Democratic Party organizations, so I have a paper that's R&R showing this, that some of this is hard. You can't really do any of this causally because we're anticipating that the Democratic Party is pulling out of places that they might do poorly in the future. So that's a huge caveat. But if you believe any of what we show there, the Democrats are leaving in Georgia specifically, 50 to 100,000 votes on the table by not competing in these places. Given that Biden's margin in 2020 was like 80,000, I think that's probably worth thinking about. I think the other thing is some of this is like a longer term project, and I think organizing in rural communities in a way that is not, I'm showing up every 4 years to knock on your door and ask you for your vote, and is instead providing a local face, a trusted face, something that's ingrained in people's communities is pretty important. I think there's a perception that in these communities at least, that Democrats do things, even like the EV factories, to get votes, but they don't actually care. And if they were there and they showed their faces around these places, they really would do something about it. So I don't know if we could expect that to pay off in the short term, but I do think competing for elections over and over again, even if you lose, is really important. And I think Democrats have an efficiency mindset. They have a data-driven mindset that is like, we should have consultant-tested candidates and we should only compete for races that we might win. And there are spillover effects to that. And I think you can go back to watch how the Republican Party took control of America for lessons, which is that they competed everywhere, even places that they thought they would lose. They ran good candidates and they became losers by smaller and smaller amounts over time. I don't think that's the only thing that made that happen, but they did compete everywhere. And I think that that's pretty important for shaping, or at least turning some of the tides on this, and could pay dividends in these competitive states. But the other thing I would say is that if I was like a liberal billionaire, I would buy up so much local media, every Sinclair-owned outlet, every sort of quasi-right-leaning newspaper or talk radio apparatus or social media app. I would invest heavily in purchasing media. And I think that a real concerted effort to provide some type of alternative, we hear about liberal media bias forever. That almost seems like a, passe at this point, that that's not real, because so much of the new media environment seems to be dominated by right-wing voices. And I think what you have to do is provide objective information about what's going on in these communities if you want people to respond to objective realities rather than the realities that are constructed for them by elites, by social media, by their neighbors on social media. And I do think that that's pretty critical. I think Michael Bloomberg could have done a lot more with his money. Instead of running for president, he could have bought up a bunch of local news, buy Fox News and shut it down. I think there are some things like that that could pay off, but I think the Democrats are facing a long-term project and not a short-term project. And I think, especially in these communities, not overall, it's not the case that the world that brought Democrats to power in 2020 or 2008 through 2016 has disappeared. It's still there. And I think the long-run gains for the party are there for other groups. But I think recommitting themselves to every voter matters, every person's concern matters, and we're the party of the little person that's trying to succeed in America and have a bold vision for the future that reflects those aims and builds them from the bottom up, in addition to having these top-down efforts, could pay off. But I think, I'm mostly concerned of what's going to happen in the short term that might make those things less likely to happen, even if they were coming.
As are we all. Thank you, Michael, so much for sharing your work with us.
Thank you all.